Cool. Can folks still see us? I'm not sure. You can? Okay. Great. Well, so we have Brady Dale Morris, Dee Conner, Arianna Lint, and myself here to share with you some of our strategies as some of the founders of this movement. And we're going to start with just, before we get started, we're going to go into just a little bit of the basics of what U equals U is. And we're going to wrap up with resources that you can actually use right now to advocate in your communities and get people to start saying U equals U, which we know they should. So let's start off with just a little music from our friends Danny and William from Love to Love organization in Uganda. What is U equals U? So U equals U, I think people probably know by now, is a widely accepted phrase in the medical and scientific community to describe the science that proves that people living with HIV who take their medication as prescribed and have an undetectable viral load cannot transmit HIV through sex. And the number to remember and focus on is 200 copies per milliliter, because undetectable measurements vary by test and regions of the world. So the 200 is actually equivalent to viral suppression. So we always hear this is a game changer. Why is it a game changer? So before you go out and advocate for people to say U equals U, it's important to know why is U equals U is important, so important to us and to the field itself. So many of us who live with HIV never imagined a time when we could love, we could have sex, we could have babies without fear. Fear has been present in the most intimate moments of our lives. So we had to protect our partners from us. U equals U takes away that fear, and it changes our social, sexual, and reproductive lives in ways that we never thought were possible. It also changes the way that we see ourselves and the way others see us, the way that we're treated in clinical settings, and the way that policy decisions are made about us in employment and housing, education, healthcare. It also means that people are more likely to get tested and to start and stay on treatment and engage in care for our health and for our partners. And this is really important. We used to just have the argument that we need treatment and care to save our lives. But I learned very quickly in the field that not everyone cares about our lives, but they are moved by the argument we need treatment and care to save our lives and prevent new transmissions, which brings us closer to ending the epidemic. So now let's hear from the champions of the campaign. You have been making incredible strides to get this message out to the public and making change in their communities. We'll start off with Brady Dale Morris, who is the chair of the National Regional HIV Planning Council, member of the founding steering committee of U equals U, and a dear friend of mine. Brady, take it away.
Hey everyone. First of all, like Bruce said, my name is Brady Dale Morris. I am the chairman of the Nashville Regional HIV Planning Council. Those of you know that is Ron White, Part A. To begin, let's go back to how I got involved with U equals U. I had the honor and the privilege of attending the HIV is Not a Crime conference in Huntsville, Alabama, back in April of 2016. And as I sat in the back of a room during one of the plenaries, this gentleman stood up and began talking about why are we criminalizing people living with HIV when they are undetectable because they can't even sexually transmit the virus. And at the time, I had never heard this. So immediately I was like, what is this guy saying? He's crazy, and he's going to get into a lot of trouble for saying this. But after the conference, I got home and I got on my laptop, pulled up Google, and got to looking up this research and began reading HPTN 052 for myself. I looked up the preliminary results of Partner 1 study, and I was like, this guy isn't crazy. This is a fact. Here I am sitting undetectable, and I'm learning that I cannot sexually transmit the virus. And what that meant for me, U equals U has been hitting my life in waves. even as recently as last week. But as I sat there, I was reading, and it hit me like, I was diagnosed in 2009, July of 2009, of late progression HIV, also known as AIDS. And while I am sitting here trying to sink this in, I read a piece of information that said that Dr. Pietro Vernaza in 2008 put out a Swiss statement stating that those of us who are undetectable cannot sexually transmit the virus. And it was a year later that I was diagnosed with HIV and still was not even told at the time of my diagnosis. And I began thinking about all the events in my life that would be drastically different had I been told on that day. Because if I had known on that day, I would never have woken up and had to look in my parents' faces while I'm on a ventilator, and I'm unable to speak to them. And all I can see is their sadness and their grief that I had just tried to take my life by overdosing on pills because I could not handle being HIV positive. And then I'm sitting there at my computer reading more and more information, and I look at my wrists, and I have these scars that are daily reminders of me feeling like I was a walking biohazard and a danger to people around me and a danger to anyone who I want to may fall in love with. And that was a weight I carried for a long time, but I was able to release that and let it go with U equals U. It made me feel like I was a human being again for the first time since my diagnosis. I felt like a functioning member of society again. And then even just like last week, I got to thinking about, I was approached 9 years ago by a couple wanting me to father their child. And I wasn't out about my diagnosis at the time. And so I had to make up a reason as to why I couldn't. But I could have a 9-year-old kid here today. Had I known U equals U back when I was diagnosed. So as these waves of impact of my life have come over me, I immediately started speaking up and speaking out. In June of 2016, I sent Bruce a message on Facebook saying, hey, thank you for putting this out. It's changing my life as I sit here and process all of this. And he said, well, hey, you can help. Just start speaking up, speaking out. So that's what I did. I used to talk about how I used and advocated for U equals U here, especially here in Nashville. As chairman of the Nashville Regional HIV Planning Council, I was able to leverage that position and the personal connections that I had made within the city to get Metro Public Health Department to sign on, one of the first Southern cities to sign on to the consensus statement. Then I also use, I co-host Pause I Am Radio podcast. I use that platform as well to speak out and to help disseminate the U equals U message. And then most importantly, I tell my story. Because, and I like to tell everyone, because you never know who's listening when you do tell your story. I've just found out this year at USCA that me standing before a crowd of CDC or a panel of CDC officials and telling my story and about the scars on my wrists, the director of health for the state of New York was sitting in the back of the room and heard that story. And that helped compel her to get New York State to sign on as one of the first states to endorse the U equals U campaign. Also in my endeavors to get the Nashville Metro Public Health Department to sign on to U equals U, our chairman or the director of Nashville Public Health Department is also a member of the National Association of City and County Health Officials. So he took U equals U to NACHO and they signed on. So just tell your story, but tell it authentically and tell it as often as you can. And that's all I have to say for now. And I'm sure there'll be more questions at the end, but thank you. I want to thank you, Prevention Access Campaign, for having me on today and giving me the opportunity to speak to everyone. Thank you.
Thank you, Brady. Thanks so much. And as you mentioned, just sharing your stories are so powerful. I think there are many people who don't quite understand how important this message is to us. Just this message on its own. It also has an effect in advocacy and in all the different ways in the field, but just hearing this, how freeing it is for us. So your message has obviously had a major impact. And someone else whose message has a tremendous impact is Dee Conner. Many of you have seen her incredible radio shows, and she's also executive director of Pause Haven and has been with this campaign from the very beginning. I'm really excited to hand it over to Dee.
Hi, everybody. Just a little bit about how I started with U equals U. In September 2016, I was at the Positive Living Conference. I use Twitter a lot, and I've seen messages about U equals U, but I never really clicked on it to really look into it. I ran into Bruce at the Positive Living Conference, and we noticed who each other were, and we started talking about it. So that day that I left there, I started sharing U equals U around September 2016. The reason why was because when I became pregnant, I was really afraid that my baby was going to contract HIV. I drove an hour away to see a specialist that dealt with women who were pregnant and diagnosed. And when I walked in her office, she said this: if you do exactly what I tell you to do, your baby will not be diagnosed with HIV. I keep telling people the doctor said it, but she didn't say it as we talked, that I couldn't transmit. So from then on, after I met Bruce, I've shared U equals U. I mean, probably almost every day, 2-3 times a week. So I just want to show you some things that you can do to share the message. It's really simple, especially on social media. So I guess we could start with the first slide. Okay, this slide, these two slides here, the one to the left, it says family love, U equals U, can't transmit. And I put this up as a post. And these are things that you guys can do. It's just small things. And then people will start messaging you and asking you questions about it. So, you know, I just wanted people to know that I can't transmit. And I showed photos of me kissing my family members. And that means a lot to a lot of people, you know, knowing that they can't transmit HIV. And within the post, I always do the hashtags U equals U and put the website for preventionaccess.org so others can click on it and find out the resources and information for U equals U. The photo with the black and white, I just put that up. It says, I don't care about flaws. I don't care about being diagnosed. And all I can be is me, take it or leave it. Hashtag U equals U. Can't transmit, no shame in HIV, in the stigma, live your best life. So it's just little things like this that you can put up to get the message out on your own. Next slide, please. And then these two slides here, one is me sitting on a bench, and I had just went to the doctor that day. So I put up my CD4 and my viral load. And then of course I put fear is not fact, fear is not fact, a stigma. What did I say? Okay, facts not fear, science not stigma. And then at the bottom I put the Prevention Access website. That is another way to share U equals U. Over here to the right, it's a photo taken by Sean Black from ANU magazine. I make my own U equals U clothes, and I put the logos on. So I make shirts and hats, leggings, and I wear them. Every day I try to wear something that says U equals U, even if it's just a button, so I can start the conversation out in the community. That's another way to get the word out. Next slide. And then this here, this was 2 years ago. Billy Willis put a post up with a photo of him talking about U equals U. So I messaged him, and then him and I together started putting photos up, and we started getting messages from other people that wanted the same photos. So we did about 60 photos together in about 3 days for people asking for the photos, and then we sent them to Bruce. My sister, my twin sister, made this one on her own. And that just lets people know, you know, that your family, you know, my family is with me with this. So I really loved when she put this up. That's another way that you can share. You can make your own photos also. Next slide, please. Now this is this is me on the streets. I go out on the streets and I talk about HIV with other people to see if people know what HIV is. And on this particular day, I talked about U equals U with everyone that I talked to. So go ahead and play the video. There's all kinds of ways to share. 20 years. People are living longer being diagnosed with HIV. I know people that have been living for 35 years being diagnosed with HIV. There's something else that's going around now, and it's called U equals U. It's a campaign. Okay. And what it is U equals U means undetectable, untransmittable. And what happens is, if you are diagnosed with HIV and you take your medication, you become virally suppressed, which means your viral load, you're undetectable. You cannot transmit HIV.
Nice.
So a lot of people are living longer. I was married to a man that was negative. I had a baby. My baby girl 16, she don't have HIV. He don't have HIV, and he married to somebody else.
Right.
So get tested. How often do you get tested?
I just had a baby 2 months ago.
Did you really?
Yes.
Yeah. So you don't have it.
No.
Yeah.
No.
Get tested though. If you having sex often, especially without using a condom, get tested.
That's why I got the condoms here.
And she got a whole bag.
Whole bag.
She was happy to have them too. So it's just all kind of ways that you can get the message out there on your own. It's not hard, you guys. If you believe in something, keep speaking about it. Like we say, speak up, speak out. Speak up, speak out often. U equals U has made me feel, I don't know if I should say liberating. So it just makes me want to keep talking about it, because it's helping so many other people to know that they cannot transmit, to know that they can have a family. And it ends the self-stigma within, and a self-stigma within society. So I just thought I'd share that with you guys and let you know that it's not hard to get the message out there, especially on social media. You can do all these little things that we're doing. So, okay, I guess that's it. Thank you.
Thanks, Dee.
You're welcome.
Just wanted to check in. We're having. It looks like we have maybe some technical difficulties with the screen. Are you seeing that the screen was sort of skewed to the left, so you could only see? No.
Just a little bit. But
okay.
I'm sure
we're going to try to fix that before I put up my slides, because there are quite a number of slides that would look weird. So apologies, please hang on for a sec. There we go. Cam is working on it. Oh, great job. Okay. Thank you, Cam. And now we have Arianna Lint, who was a part of this campaign since before we were even U equals U, and has participated in videos and has been talking about U equals U and educating about it for such a long time. She's executive director of Arianna Center, and is also, as everyone on this webinar, is a founding member of the steering committee. So take it away, Arianna.
Hello? Hello?
We can hear you.
We can hear you.
Oh, that is a D.
I know. I don't know what's.
My makeup, Camaro.
Okay, there you are.
Let me take off my glasses better. Well, if everybody listen, hello everybody. My name is Arianna Lint. I am the director and founder of the Arianna Center, Trans-Latina Florida, who is a trans-led organization led by one transgender woman of color living with HIV, who is myself. I'm based in Fort Lauderdale, Florida area, and I part of the U equal U from the beginning when I was invited by Bruce in one USCA conference and told me about the information about U equal U. For many years, I was part of the health department in Florida, working there in one HIV clinic. And I know the doctors, they don't say in that moment about the importance of to be undetectable and the no transmission if you are undetectable. I remember one day when I asked to one of the doctors at the clinic if one person living with HIV is undetectable and don't transmit, why you don't tell to your clients? And the doctor told me one information who we cannot go out. We cannot say that. That is a very confidential information, and we cannot spread the information. So when Bruce tell me, I was ready out. I was ready out the news and the information. So I don't feel guilty and just join this amazing campaign. Who many persons in the beginning was shy or afraid to be part of this campain. For me, for a transgender, trans-Latina living with HIV, for transgender person who management and give services to many other transgenders in Miami and South Florida area. What is the first and the second place on infections in HIV was very important to share. And like, I don't have regret or nothing to just be part of this amazing campaign. And I'm so glad this campaign now is over the world and different countries and different continents. And I'm so happy for that, so happy for Bruce, but especially so happy for the advocates and the activists of the HIV field, and specifically for those advocates and activists who they are part of the marginalized communities like myself, like transgender community. But for that, and like I mentioned in the beginning or in previous, these campaigns over the world, I want to introduce one of the most beautiful videos and empowered videos for one of the transgender woman activists in the world. Her name is Dina Rake Bones, and she's the chair of the Transgender Europe. And I'm so glad to present this video, and I least meet in this video to her for this empowered and wonderful transgender woman who make amazing work around.
Lastly, we need the undetectable is untransmittable or U is you message to become standard knowledge worldwide. It needs to sound louder every day, as this eases the burden of stigma and self-stigma of people living with HIV. It will save lives. It will reduce suicides and murders on trans sex workers especially.
It's very important. I'm back. Everybody hear me?
Yes.
Okay. So it's very important for transgender individual specific. This vulnerable community around the country, around the world, be part and be educated about the U equal U message. Specific, I take a U equals U undetectable viral load for many of the services in my agency, who we are have close to 60 or 70 transgender women and case manager, and many of them they are HIV positive. What we focus is get undetectable viral load in a window period of a year of case manager. A specific case manager for those population, for those individuals who they really need case manager. And the case manager is going to be more than give medication, call for appointments or for eligibility, right? My case manager is comprehensive and exclusive and inclusive for transgender individuals who they working with their own health, management their own health and being detectable through the social different aspects like case manager, change your name, and then educated about U equal U importance and the importance to get undetectable and adherence, right? One of my programs in the testing program, when somebody is positive, at the results we put your next step is you are reacting. Your next step is get undetectable. U equal U. Because I remember in 2006 or 2007 when I get diagnostic, I remember exclusive when and don't forget the words of you test come positive, and that is devastating for many people who they live with HIV and they are not educated. So it's very important from the beginning, from one person who already have that thing in mind and say being undetectable is not transmitted. It's a person who can perceive the happiness, make the lives. Also, I think in my personal history, in my personal journal, I think becoming HIV positive give me the opportunity not just to management and one chronic disease and terrible for other person, but management the stigma, and also give me the opportunity to HIV field or give me just one job like a peer. You know, the importance of transgender individual who they living with HIV and they don't have opportunity to job, to working, to management, how you can get undetectable those community, how you can get undetectable those community when you don't know what time is the time when they go to nap or sleep or they go to work. Transgender community is a unique community and it's very important in the HIV field. That is how important is becoming educated and be part of this amazing campaign and amazing information, because that is just a true information. I think the best happiness of this from Bruce and for everybody who was here from the beginning and this campaign was we don't say nothing what is not true, and the truth always is more heavy than lie or don't say the truth. So I think it's very important. And for me, one of when I'm not here in this work, you know, because transgender individuals have only 35 years in the United States, 35 years of life, you know, like the expecting life of transgender is 35 years. I'm 46 and I'm a person living with HIV. For me, I am a survivor. But I know when I'm not in this world, I want to be just so happy to be part of the correct side of the history. Share and be part of helping Bruce from the beginning. I think I was the first transgender who they activist in United States who was accepting that invitation from Bruce with no comments and with no questions, and that is one of my biggest good moments in my life, to be part of the correct side of the history, and especially give just a little piece of the importance of the transgender community and the HIV field around the world, and specific in United States, and specific in Miami and South Florida area, where is the first and the second place of new infections in United States. But thanks God, the new data from Tallahassee and from the Department of Health, they can make a increase few little points of progress in the prevention in South Florida. And I think it's I'm so proud, maybe it's part of the work, what we do in helping and educated transgender individuals, and specific educated. And also we don't talking about the U equals U, how we can use in the criminalization law, when in Florida and different states, they have a different against people living with HIV for when the state and local regulations. So I just want to be so happy and say thank you so much to all amazing people from U equals U, and that is part of my comments and my talk.
Thank you, Arianna. Thank you so much. And you know, you've just been such a champion since the beginning, and it's true. We're just speaking the truth, and we're on the right side of history. And you've been pushing this for over 2 years, and bringing people to the right side of history. And I think that's what it's all about, is moving people to tell the truth. So now I'm gonna talk a bit about, you know, briefly about why and how we started U equals U, and then point to some strategies and resources that you can use right away to bring this message to your communities, whether you're educating providers, HIV providers, or AIDS organizations, or your sexual partners, or your families, or your churches. You know, we've been curating and will continue to curate resources that we think will be helpful, and they're on our website. But first, you know, why did we launch U equals U? So we really see this U equals U as a human rights issue. You know, all people living with HIV have a right to accurate information about our social, sexual, and reproductive health. And it wasn't fair. It wasn't just that I learned U equals U in 2012, and a white cisgender man of substantial privilege. And I was so happy, you know, it changed my life, just as Brady and Dee and Arianna were saying, but millions of people weren't being told. Millions of people were still not being told. And the main reason for that is this gap in science between science and between the public. The body of science that was proving U equals U doesn't have a publicist. It doesn't have its own, you know, no one was sort of taking care of that message. So the studies related to U equals U, those individual studies like HP 10052, which was the science breakthrough of the year in 2011, that was promoted independently by NIH. And so were the other studies promoted by the agencies that are affiliated with them. So people were not getting the big picture information. They just didn't have access to that kind of information. And there really, you know, really wasn't anyone drawing conclusions. And I think if people did agree, and what we saw, unfortunately, and I think my friends on the webinar will also agree, that too often we saw that people were withholding and distorting this information, even though they knew U equals U was true, because the medical and public health establishments in the US and many parts of the world have given permission to HIV information providers to decide for us, to make decisions about our bodies for us rather than educate us. So to try to control us rather than trust us with information, especially women and communities of color and people already marginalized by an inadequate healthcare system. And then, of course, U equals U is a radical challenge to the status quo. And not everyone is comfortable with such a drastic change, especially after 35 years of fear of HIV and people with HIV. So that's where we came in. We were going to bring the science to the people. And it kind of started out when we went to the researchers, the groundbreaking studies. And we said to them, did you know that your research wasn't getting out to the people's intended to benefit? And they didn't know that because their job is to conduct research, not ensure their collective research and the conclusion on all their research gets out to the world. But they were passionate and they worked with us over 6 months on a consensus statement to confirm U equals U was true based on the body of evidence, not just one study. And then we went and we took that consensus statement and we sought out influencers, individuals and organizations and researchers that would sign on and become allies to help us get that message out. And just around that time, I had a conversation, so this is back in September of 2016, I had a conversation with Rich Walitsky from HHS, that a 3-hour conversation to jumpstart the process, that review process with the feds and the community to update their definition of HIV risk, and that included also the CDC. So it was a really exciting moment. And at the same time, we were reaching out, also there's photos of Carl Diffenbach and Rancourt, Dimitri Daskalakis, Dr. Fauci, Oni Blackstock, and Michael Brady, just a lot of the heroes of this movement early on. So I just want to acknowledge and honor them. And so on that time, we were also reaching out through social media and developing our network around the world and really starting to show our force through this growing community of people and organizations that were pushing the message out around the world. They were taking the consensus statement and getting organizations to sign on. So this is Chicago, Toronto, New York City, Melbourne, Sydney, Mauritius, Lyon, Tokyo, Paris, Kampala, Madrid, Ivory Coast, Montreal, Guatemala, and Washington, D.C. And that's just a fraction of the energy and the excitement that's going on around the world. We also, last summer, 2017, we took the stage in hallways at IAS 2017, orchestrated brilliantly by Charles King from Housing Works, and we held a press conference at which UN AIDS confirmed U equals U.
U equals U, my body, my rights. U equals U, my body, my rights. U.
And then a few weeks later, right after we took the stage at USCA, Dr. Anthony Fauci, the world's preeminent immunologist, confirmed U equals U, flanked by 2 huge screens saying U equals U. That was a historic moment in the epidemic. Absolutely, history was being made. It was also being made in the hallways and in meetings because we were having intense dialogues with the CDC, NIH, and HHS about the risk language, about changing the language. And shortly, a few weeks later, the CDC and the HHH working group released their risk assessment across all departments, which included the CDC. And to effectively no risk. Effectively means actually, but not officially. Actually, but not officially, or in effect, no risk. And I'll explain a bit about that in a minute. So you've got backup. The CDC is backing you up. The VA, the largest single providers of AIDS care in the United States, has a U equals U page and actually acknowledged our community, which I thought was really wonderful to have a federal health department mention the campaign and the community. And NIH, Office of AIDS Research, calls U equals U a game changer. This was a wonderful article on our website. World Health Organization, UNAIDS agrees. Many media outlets, including The Lancet, the #2 medical journal in the world, agrees U equals U. This has been everywhere in China and Nigeria and India, Kuwait. Grindr agrees, so you can click on your status button and you can go straight to the sexual health page that says U equals U. Thanks to the body, we were able to rewrite Grindr's sexual health page. It's also, they've translated to 32 languages. Here's on the left is Polish and Bulgarian. So now the campaign is in nearly 100 countries, 750 organizations because of this incredible community, the people on this webinar and the feds and so many incredible leaders and public health officials all over the world and researchers who've stood up, activists, advocates. There are now 23 public health departments. As we mentioned, Brady was effective in getting Nashville on board, and in New York State, helped to influence New York State, so you can see what advocates do. And then we really looked at, okay, what are our strategies for advocacy sort of within the system and activism outside the system? So we look at a couple different, there's like 3 steps that we look at. Okay, so first, learn the science. Okay, and our website can help you with that. And approaches from the basic level that we have a right to accurate information about our social, sexual, and reproductive health. It's our right. Now, sometimes that works, but sometimes you need to go to outcomes-based. So to explain the improved outcomes for people living with HIV on a personal level, it keeps us not just physically healthy, but also our mental health, holistically healthy to know this, and then also for public health because of the prevention of new transmissions. So usually that's where we get to. Then we move to a tactic that may put you at risk. May put your job security, your personal reputation, your professional reputation at risk. So please, keep in mind and assess if this is safe for you. This is where we do things like we're, threatening to expose the doctor or clinic or organization for promoting lies about people with HIV, or comparing them to their peer organizations or their cities and saying they're doing this in New York, why aren't you doing this in this city? That they're doing the right thing here, what are you doing? So like comparing them to their peers, and then threatening to do blogs or stories about how these organizations are putting our lives at risk by promoting stigmatizing information about us, by exaggerating the risk. You're putting our lives at risk. We threaten to protest outside people's office, throw our safe blood on them, things like that. And in my experience, the tactics have actually worked. And people have come around, but keep in mind that they might change their actions, but underlying those actions, the underlying prejudice and paternalism and racism, colonialism may be there. And it's going to take a long time for them to forgive you for challenging them, even though it was the right thing. So do keep that in mind before you take the shaming tactic. So bottom line, I think this slide tells it all. As Arianna was saying, this is the truth. And stigma is a public health emergency. We need to treat it that way. And we know U equals U is the most effective response we've ever had. So tell the truth, or we'll tell it for you. And believe me, we are telling the truth all over the world. And now we're going to give you some tips, sort of a down and dirty, about how to say U equals U, why language matters. First and foremost, you must be consistent and clear. And we really can say, can't pass it on, can't transmit, effectively no risk. Those are things we really can say. So it's okay. And say it repeatedly, because it takes a little while for people to get it. And then be careful with these minor word changes or phrases like use a condom just in case. I agree with U equals U, but use a condom just in case. That means still a risk. That means there's still possibly a risk, and there isn't. You don't need to say that. And then with statistics, if anyone comes at you with statistics, it's just absolutely, it's unnecessary. We can never rule out that something won't happen. Like, we cannot rule out that my head won't explode right now all over this computer. The risk will just keep getting closer and closer to zero. So it's really not helpful to say things like we cannot rule out the risk may not be zero in the world of statistics, in the world of theory. You need to put that into context. And then focus really on the carrot and not the stick. So focus on the confidence and pleasure associated with staying on treatment and engaging in care. So if you stay on treatment, engage in care, you can live your life. And then we have just like a little easy way to remember it. Give yourself some TLC and give your patients some TLC. Treatment labs and connections. Take your meds as prescribed. Get your labs done twice a year and stay connected to care. Some of the nuances that you should know about are, as we said earlier, it's 200 copies per milliliter. It's only about sex. It doesn't, undetectable doesn't, U equals U doesn't apply to breastfeeding or needle sharing, unfortunately. It is only for HIV, so not for other STIs. So you might consider condoms for other STIs. And it's one option in the sexual health toolbox. There's also PrEP to prevent HIV. And then disclosure laws. This is a very complex issue. We actually have a couple really great articles on our website about U equals U and CRIM. What we definitely need to know is it's not an exemption. There's these heinous disclosure laws, and whether or not you're undetectable or detectable, you may be subject to these laws. The point is no one should be subject to the laws regardless of viral load status, and viral load does not equal value. You know, in the United States, we know that 50% of people do not have an undetectable viral load, some by choice, but many by circumstances that are out of control. So we really need to be conscious about communicating about it and acknowledge the barriers to care that many are facing. And to say, you know, getting to undetectable is not a public health obligation for anyone, for people with HIV. It's our choice. It's our personal choice. We're not prevention tools. And there's a lot of ways to talk and be mindful of V does not equal V. And most importantly, we have to be using U equals U in our advocacy for treatment and care and diagnostics for everyone living with HIV. On our website, just real quick, I wanted to show you the resources page has really helpful information as well as the news page. We're redoing the website in early 2019 to make it easier to find and download resources, but for now, I would check out resources as videos, songs, fact sheets, websites, social marketing campaigns. HIV Medicine Association just put out this excellent resource for providers, downloadable from our website. You can find allies. It's really important to build coalition and build alliances, because when you start saying U equals U, especially when you're maybe the only one in your community, people aren't going to believe you, and they might start fighting you because you're radically challenging the system and the way it is. So I encourage you to go to our website under the community partners page and find organizations that are in your area. Right now there's 753, so there's pretty much all over the world. There are excellent videos on our website for learners who are more likely to engage with visuals than written content. There are a lot of examples of social marketing campaigns in the US, in the UK, and in France. I equals I in Spanish and Portuguese. It's B equals B in Turkish, N equals N in Dutch, H equals H in Macedonian and Russian at the bottom, K equals K in Vietnamese. Next to K equals K is Arabic, then Japanese, then Chinese. So lots of different examples of campaigns. I'm really proud of the campaign that we just created with financial editorial support from Thieve. This is to educate people about U equals U and engagement and care. This is like a really cool customizable campaign. So you could have your logo where the smiley face is. You can actually put 4 logos there and take off our logo and Thieves. So you can make it your own. You can decide on what kind of risk language you want to use. Some people don't like effectively no risk. They want to say can't pass it on or can't transmit. And then you can choose from 5 different languages for videos, and there are GIFs. And so it's actually really cool. So you can share the message in real space, like in offices or with clinics, and also in virtual spaces on social media. So now, just before we wrap up, if you're wondering which way to go, and I think most people on the line are like pretty into U equals U and pretty understand, but if you're thinking about which way to go, remember, there's a global movement behind you. There are people from all over the world to connect with and to support you. And borrow confidence from the scientists. These are the experts on U equals U. These are the people who know U equals U better than anyone, and they're on your side as well. Borrow confidence from them, from Dr. Fauci, because they have your back. So I'm going to close with advice from one of the foremost experts on HIV transmission risk in the world, Alison Roger, who is the author of the Partner Study. This is at the end of her presentation at the World AIDS Conference, the largest AIDS conference in the world, this past summer, and I actually have a little cameo in it. Here we go.
Oh, it looks like we've got one more, and it has to come from U equals U himself.
Hi, Alison. Today is marking a revolution in what it means to live with HIV. So thank you so much for your research. I have a question on behalf of the U equals U campaign. There are many providers that are still not accepting this message. They try to focus on the risk is not zero scientifically, or they focus on their patients aren't going to be adherent and they won't know that they're detectable, or they say there's a rise of STIs already, so they don't want to share this with their patients. We get every single kind of excuse, what would you say to clinicians or any other information provider who is withholding this information from people with HIV?
Yeah, and I just want to pay tribute to the U equals U campaign. It's been astonishing. I think the time for excuses are over. I think it's very, very clear that the risk is zero. So I very much think we have to promote this. I think if you're on suppressive ART, you're sexually non-infectious, and yeah, the time for excuses is over. And I again pay tribute to you and your work. Thank you.
Well said. Thank you, Alison. Great.
Okay, the time for excuses is over. So let's get together and redefine what it means to live with HIV, people. Here are some ways to get involved, and then we're going to do some Q&A. Because I think we can. Do we have some questions that are up there already? We have one already. Okay, so we have a question. So first is sign on, because if you sign on as a community partner, it's really the easiest way to get connected or sign on individually in our contact sheet for the website. I mean, on our website, and it'll keep you up to date with at least the resources. And then also, check out the site, get educated. There are different ways of getting the information for different learning styles. Some are more research oriented, some videos, infographics, and then use a map, as I was saying, to build coalitions, to find your partners, engage in trainings like this, organize your own trainings, your marches or protests. We have lots of examples of what people are doing. I know William Matovu, if you're on, is organizing one in Uganda coming up. We're excited to hear about that. And if you're not on social media, now is a great time to join. I think most people are, but you join our Facebook group and Twitter and Instagram. We really need each other. This is still a new message. It's still very much a radical, it's still a revolution. So we really need to support each other and continue to be consistent. And then finally, obviously communicate it. So share the message loud and clear. Make it a priority. Get it into all of your newsletters and speeches. And whenever you talk about stigma, please talk about U equals U. Please talk about you. It fits in with pretty much everything in the field. Treatment, stigma, criminalization. Because chances are someone in that room doesn't know, and you can change their life. So thank you so much. I think we're going to go to Q&A now. Yeah. So I'll keep this up on the screen just for another minute. And then
we have one question about the timeline of when European studies were published.
Okay, the timeline of when the European studies were published. So like Partner. Yeah, Partner was presented at CROI in 2014, Partner 1. And then it was published in the summer of 2016, the first one. And then it was extended to get more data on men who have sex with men and anal sex and then it was presented at the World AIDS Conference this past summer. So I think if that's what the person was asking about, the European study is well known as Partner. Australian study is opposite track. The US study was HPTN 052. There's a Swiss statement.
If there are any questions, there's another one. How can we effectively change HIV criminalization laws?
Oh, well, U equals U isn't the answer for that, I would say. I mean, I can, Brady, if you want to talk about it, or Dee as well, but it's very complex because if you put U equals U as the leading argument in criminalization reform, then you're subjecting people who have detectable viral loads to these awful laws, and their laws are just bad for everyone. So it's like a balance. It's a part of it, part of the strategy. But the main thing is don't lose focus that laws overall the laws have to be reformed for everyone living with HIV, not just people who are undetectable. But it's being used in defense cases now, and as a defense. Does anyone else want to piggyback on that?
I was going to say the Center for HIV Law and Policy has a great consensus statement on HIV criminalization and U equals U and how the two fit together. But for more information, I would go turn to them.
Great point. That's on our website too. We have a criminalization section. It's really a good point.
We have two other questions. One asking about copyright when making shirts or banners, and the other question is this initiative supported by pharmaceutical companies?
Okay. Do you want to take the copyright one, Dee or Brady? I mean, you know the answer, right?
What was the question for copyright?
Oh, is it copyrighted? Well, the answer is no. Don't worry about it. Just take it. Just go with it. I mean, if anyone, if someone's using it in the wrong way, then we'll have an issue. But no, we didn't copyright it. I mean, we were first used, so there's common law copyright, I guess. But no, it's everyone's. U equals U belongs to everyone, the community. And then in terms of pharma, yeah, we are funded by pharma. ViiV, we just started getting funding last year. So ViiV Pharmaceuticals funded the some Southern campaign and also that social marketing campaign called Series, which Dee is in. Oh, I forgot to mention, Dee is in the campaign. He's one of the stars. Yeah, and Janssen has also been tremendously supportive. Gilead, we just got funds from Gilead. It's interesting. Just like two weeks ago, someone was criticizing the campaign for being taking money from pharma, but I think everybody in the field takes money from pharma. It would be hard for you to find any, even activist organizations. So we're very grateful, and we've had a good working relationship with all the pharmaceutical companies. We have the same interests. We want to get the medicine to people and get people undetectable.
There's one last question that Alex wrote. I didn't hear much about the benefits of early intervention. Legislators like to hear that it will cost less to take care of sick people are late to care. But my question is this: does this mean jurisdictions are getting people in care? Are there any suggestions to help affect expanding access to meds and care? Yeah, the public health argument, Health Gap, I know, is actually working in Malawi, and we'll be working with Housing Works in Haiti on using U equals U to get access to viral load testing. And I know that, so in terms of access to medication or viral load testing or other services, it's a really strong argument. And I know it's being used in various places, and also like in Eastern Europe and Central Asian countries. We have 16 countries in the EECA that have signed on already, thanks to Alex Schneider. So yeah, that definitely is happening. I mean, it's just a really strong argument to a policymaker, because policymakers, and what I've experienced, they don't care about our lives, and they don't believe healthcare is a human right. So they don't, I believe that, we all believe that, but they don't believe that. What they care about is costs, and they want to prevent HIV from spreading to their people, to their community. So that's where people start to listen. Even Betty Price. It looks like we are unfortunately out of time. We will be sending a follow-up email to everyone who is currently attending the webinar, as well as those who registered. So if you have any questions, we will be in touch over the next few days. And again, please feel free to reach out anytime.
Thanks, everybody.
Thanks, everybody. It's great to see you.
Share the message. Share it.
U equals U. Go tell 10 people tonight.
Share it.
10 people. Thank you.
Bye. Thank you.
My amazing panelists.